Good morning. I'm Dr. Velasquez, Health Officer for Spokane County. Thank you for joining us today. And today I have one of our community partners and colleagues, Zeke Smith, who is the president of Water Meets Foundation. And just in case you don't remember, it used to be called the Empire Health Foundation. People ask that, so we gotta make sure that everybody knows that this is their new name, which reflects their broader mission in the community. So, Zeke, thank you for joining us today.
Thank
and
you.
we have a very special topic that him and I have been able to participate in for the last many months. But many folks have heard about this Safe and Healthy Spokane Task Force.
Mm-hmm.
And some folks have an idea what it is. A lot of people are going, well, that sounds interesting. What is it? So we invited Zeke, who's one of the conveners of the task force, to come here today and tell us a little bit about it. So thank you for joining. So the first question is, so we have this task force. What was the genesis for that task force? Why did we put that group together?
Yeah, thanks for the question. I'll take us quickly into the Wayback Machine. November 2023, folks might remember there was a ballot measure that the county had put forward around sales tax increase of 0.2% that would have gone to public safety broadly and specifically to county jail. That ballot measure didn't pass, and in the aftermath of that, a group of us felt like there was value in getting people together because we knew that public safety, public health were really critical issues here in this community, that there was need for additional resource, but also need for better coordination across those systems. And so we took a group of folks to Whatcom County where they had similarly had a ballot measure, but had passed their ballot measure after a good bit of public engagement. You were actually one of the folks that, I think we had about 20 folks that went to Whatcom County, couple of days there to really understand what they had been able to do in their community. And part of what that created was an energy around learning more about what was happening here. So we spent a good bit of time with a group of folks across multiple different stakeholders, really diverse set of perspectives, thinking about learning about what our systems are here around public safety and public health, what's working, what's not working, where our gaps are. And that ultimately led to the formation of this task force, Safe and Healthy Spokane Task Force. And the charge of that group was to consider public safety, consider public health, specifically behavioral health, and the intersection between those two spaces and systems, and really to focus on how might we better coordinate our system of care as a whole to ensure that we can get better outcomes, both for individuals that really are affected by those systems, but also for the neighborhoods and community members more broadly. So that task force, about 44 individuals from across the community, has been really focused on trying to come up with a set of recommendations that are actionable here around how we build a different vision and a different future for our public safety and public health system.
Wonderful. So I appreciate you giving the background because I think it is important for everybody to remember that this is not something that we just came up with. This requires a lot of very careful thought, consideration, and learning from other communities because we're not unique in some ways. But I want to emphasize two things that you said, which is this wide collaboration and with the focus of coordinating what we do a lot better so everybody gets what they need and deserve from public safety, public health, mental behavioral health, et cetera, et cetera, et cetera. So you alluded to the goals of the organization's task force, the goals of the task force. Can you share with our audience what are we trying to achieve?
Yeah, thanks. So broadly, the goals are around improving public safety, improving our mental health services and supports, and really seeing those things as connected. And then this idea that we both talked about in terms of coordinating our systems around that. More specifically, the task force has also engaged a broader set of community members. So again, really widening a diverse set of stakeholders that are involved in providing input around 4 different ways to think about those bigger buckets. And one of those is around prevention and crisis prevention. What are all the things that we are doing, should be doing, and can be doing to support people before they end up in our criminal justice system.
Right.
As far upstream as thinking about education and early education, but also intentionally focusing on that point of intervention that often happens before somebody is either arrested and or gets other kinds of services and supports. And then the second bucket is really looking at what happens in the criminal justice system, both how do people move through the judicial system? There are 3 different court systems in our community, which don't always work together very effectively. So how do we really create a system and a structure there that's ensuring that we're moving people efficiently through that process, still taking care and paying attention to broader public safety, but also paying attention to what's the right intervention or what's the right program or opportunity for addressing the issues for that individual. And then also thinking about what happens when people are in custody, when they're in our county jail, and how are we still paying attention to ensuring that the right set of services and programs and supports are there. Part of this conversation has also been about the ways in which our jail was built in 1984, and it was built for a different set of issues and dynamics. Lots have changed, as you know well, and as your organization has really paid attention to, and we haven't kept up with that in terms of the facilities. So a third area is how are we paying attention to the fact that just about everybody who's going to be in our jail system, in our criminal justice system, also is going to re-enter community, and are we intentional about the ways in which we create a handoff to community organizations, to community systems, so that those individuals can be incorporated effectively, and we don't see them rolling back into the criminal justice system at the same rates. And then the last area, which I alluded to, is thinking about the system coordination work and the kinds of facilities that are needed to be able to ensure that the programs that we're investing in can actually be effective. So I'll be really clear, that is about a jail as one of those elements. As I mentioned, we don't have effective facilities to address that issue today. We need those facilities to be modernized and better. But we also need to be thinking about what other kinds of facilities need to be in place. I know the county just broke ground on a new behavioral health support facility called the PATH facility. So those kinds of services and supports, how do we make sure we have the right both public facilities but also community-based facilities to support that as well? So it's a function of what are the services and supports that are needed before, during, and after, and then how do we have the right infrastructure, including facilities, to really support that. The other piece that I'll say that is a piece of that is how are we accessing and using the right data and information to inform how we understand this. And part of the reason I mention that is because the Regional Health District has really played a key role in figuring out how we pull different data sets together and understand what's happening with our population, both from a public health standpoint, but also from a public safety standpoint. And so as we move forward, I think part of what the task force is going to lean into is how do we continue to support that integration of those data systems and make sure that we've got organizations like the health district really equipped to be able to share that information with people in a meaningful way.
Wonderful. I do appreciate you giving the global perspective. And I'm glad we're recording, because actually it's a great example of a summary of what the task force is supposed to be doing. And I think as people listen to it, they will get how comprehensive and how intentionally inclusive we've been trying to bring to the table. And by now, I think with all the subcommittees, there's close to 100 people that have been engaged in all areas of the community, just to make sure that we're getting all the opinions, all the perspective, all the experience, all the knowledge that we need, because at some point, and this is the question I'm going to ask you, so where are we in this journey, and what is the next step?
Yeah, it's a great question. We have intentionally put a kind of a time certainty or a timeline on this task force work. One, to say this isn't a body that we're trying to pull together forever. And two, to be able to really get clear about what are some of the next action steps really that we can take as a community. So the task force is meeting one more time. They've met. This will be their 8th meeting together in the beginning of May. The advisory committees that we talked about have met twice and will be meeting one more time at the end of this week to finalize their input on this set of recommendations. The task force ultimately is going to agree on a report that is both designed specifically for our elected leaders at the county, at the local jurisdictions, the cities, but also that is more broadly a report that identifies areas where we can take some action, and that will require, back to your point, coordination. It'll require all of us from different vantage points, whether we're community members, whether we're business leaders in the private sector, or whether we have roles in the public sector, whether we're nonprofit partners, to be able to work together to really continue to build out the kind of system that we need that gets better outcomes for all of our citizens. So we're coming towards the end of the task force's work at this point. One of the questions that the task force is really grappling with right now, and that we hear from other people as well, is like, okay, that's great, but then who's going to be responsible for doing this work moving forward? And I think there is still will be a recommendation from the task force about how we create an accountability structure for moving this forward. And it really is about building a set of constituents who really care about these issues and can see ways that they can contribute. And so it's like, how do we pull those different pieces together? Again, in many ways, I think similar to the work that your organization does, having to work across jurisdictions, across different communities, and how do you kind of pull those and weave those different pieces together? And some of that is about having an effective structure to be able to accomplish that, and some of that is about having the right sort of mechanism for people to really bring their energy to the table, which I think has been part of what we've tried to do, is really bring different, disparate perspectives, viewpoints, experiences in together to say, actually, see, there's actually quite a bit of commonality as we think about the things we care about in this community, and let's focus on those things we can agree on, but also that we, by bringing those different perspectives in, we actually get better solutions and better ideas of how we create that braided path forward.
Wonderful. So commonality of purpose, I think we can all agree on a number of things. We don't have to exactly agree how we're going to do everything, and that's okay. But the energy in the room is always, okay, we want the best outcomes possible for all. End of story. So who needs to be at the table, and how do we get the pieces of the services and the support that we need? So regardless of where people are transitioning through in the community, they are getting what they need at every stage of that. Because as we've talked about it before many times, we in the community will transition from one place to the next place to the next place. It could be a hospital, it could be a correctional facility, it doesn't really matter. But what happens there is going to impact what happens when you leave that particular entity and go back to the community. And you alluded to that, and I just wanted to highlight it, because this is not about episodic.
Right.
This is about longitudinal and coordinated. Yep. And I think that's a very, very important point for people to remember. This is not about what happens here or here or here. This is about what happens here in the totality. And the totality for each individual is a little bit different. So you mentioned some of the timelines and so on and so forth. We've mentioned lots of people, high level, who's involved, how have been people able to participate, will there be an opportunity for additional participation as we go forward, if people are interested, whether should they go, and how can they find more about it?
Yeah, well, there's a website, which I think will be linked in the this
Facebook,
Yep, Facebook. But it's safeandhealthyspokane.org. That website includes recordings of all of the task force meetings, minutes or notes from those, and other kind of documents that have been built along the way to help support this, as well as a whole bunch of background documents that this community has actually engaged in before to really kind of study and figure out how we move forward on some of these issues. As we move forward, and along the way, we've also tried to give space for task force members to be able to engage different community groups. What we're doing right now is a great example of how we're trying to get this information out to share with people. There are going to be a set of recommendations from the task force that will have then a number of actionable ideas related to them. And I think there's opportunity there for people to look at that and say, oh, actually, this is an area that I care about, that I'm invested in, this area that I work in, and so how can I contribute there? So some of this will be about how we each have an opportunity to look at that. And then, as I mentioned, we're still working on kind of what is an accountability structure that allows us to hold each other accountable, both as systems and as organizations and as individuals around this. So this won't work if we don't have county leadership, both in terms of elected leadership and staff leadership, City of Spokane leadership at each of those levels, City of the Spokane Valley and other cities all agreeing to work both within their jurisdictions but also across them on how we tackle these issues together. It won't work if we don't have business community members saying we've got a role in helping to resolve this, philanthropic organizations thinking about that, the nonprofit sector included in that. And then the other thing I'll say that the task force has done a really nice job of is elevating where we have ways in which our current systems don't support particular folks. In particular, there's been a good conversation as you've been a part of around the role of family members and how we ensure that our systems are designed in a way that when family is ready to and can be a part of the path forward for individuals that are involved in the system, that we create those mechanisms for that to be true. And similarly, that we create those kinds of spaces for the community organizations that have peer navigators, that have case managers, that have different people who can also be a really important part of helping those individuals on a different path forward. So there's intentionality, as you mentioned, around how we've really tried to create a diverse space. But then moving forward, I think that's a key part of what needs to be continued as well.
Well, I appreciate you coming here today. I want to tell to the folks in the audience to please go to the website because everything is there. There's no secrets.
Yeah.
There's no deals. Everything is in the open. We've had some interesting conversations. I personally have learned a lot from a lot of people in the room with whom I may not have had the chance of getting to know before.
Yeah.
And I think this task force has actually not only is doing the work that it's supposed to be doing, but it's also has become a place where additional connections, contacts, and relationships are being built every day that will continue and that will be important for the community. So I do want to say thank you to you. I want to say thank you to the conveners that brought all of us together. And this is a very sophisticated effort. I know there's a lot of work behind the scenes. We have 3 consulting groups with specific expertise to make sure that everything is done professionally. So I want to really encourage the community to take a look at it. I want to encourage the community to learn about it because at the end of the day, we, the community, are going to have to think about, so what is it that we need to do? So every member of this community gets the services and support that they need, whatever they might be.
Yeah.
So I think that's the bottom line. Any last thoughts for our audience?
Yeah, I just want to thank you for your participation. You've been a key member of this process from the beginning. And you do that in your role as a lead at the Regional Health District, which is wonderful and important because that's an institution that needs to be a part of this. But you also do that because it's something that you care passionately about. And that's both the issues that we're working on, but also the ways in which we as a community come together. And that comes through, and I appreciate it.
Well, thank you. I appreciate that. And folks, I hope you were paying attention today. I want to say thank you again to Zeke and the whole team. There's a lot of people getting this done. Please go to the website, check it out, learn about it, because we're going to have more conversations over the next few months, and the better informed we are, the better able we're going to be to really support, provide suggestions, and or direction as we go forward. So thank you again. Folks, we'll see you again next week. Stay well, stay safe, and take care of yourselves. See you next week. Thank you.
Thank you.